you take the head, the inside of the head, take the top off and look at it like this, that's what you're seeing here from the inside. So the meninges that Carol was talking about, if you think about something that you have that's very, very precious and you want to take really good care of it, so like a brain and a spinal cord, and you want to make sure that during the day and during your life, nothing bad happens to your brain and spinal cord, we're going to package it very carefully. So these meninges have that function of packaging and preserving these precious contents. So say you had a crystal vase that you wanted to ship to somebody, and that beautiful crystal vase, you want to make sure it gets there intact. So you're not going to just throw it out the window and do a Hail Mary, hope it gets there. Even if you sent it in a nice cardboard box, you're still going to want to package it. So the first thing you would probably do is wrap it up in tissue paper that's very close and around to make sure it doesn't get scratched. That's the piedmont. That's that fine inner layer of the meninges. Then you'd probably put it in a box with some kind of little peanuts or styrofoam filling that will kind of move around, be more fluid, and absorb some of the shock. That's the arachnoid layer that's more fluid. And then the whole thing, of course, would be inside a big cardboard shipping carton, and that's the dura mater. So you have this tough outer layer, this fluid inner layer, and then the tight, the pia mater that's close around the brain itself. So all of that protects the brain and spinal cord, and it's within the head. Now what Carol was talking about is the contents and then the container. So if your skull is the container, your brain is the contents in here, then you have all those nice meninges to cushion things with the cerebrospinal fluid to give it lots of cushioning and room to move around. But when you get to the point of a concussion, and it usually does take repeated blows or else a very, very hard one, but when that impact comes in that literally shifts the brain within the skull to hit the other side and then bounce back, you have that trauma along that intersection between the brain, the meninges, and the skull itself. So this just shows you how these are oriented. Inside the head, you not only have the meninges around the whole brain, we also have this layer that comes right across here.